Gentlemen, let me ask you something honestly and without judgment. How often does your partner actually reach orgasm from penetrative sex alone? If your answer is not usually, only sometimes, or almost never, I need you to hear this clearly. It isn't because you're lacking, failing, or not trying hard enough. It is because her body is wired in a way that requires consistent clitoral stimulation, not just penetration. And once you understand that physiology, everything in the bedroom becomes easier, calmer, and far more satisfying for both of you. I'm Dr. Lena, urologist and men's health specialist. For the past 6 years, I've helped men rebuild confidence, correct performance frustrations, and understand female pleasure from a medically accurate standpoint, not myths, locker room assumptions, or unrealistic adult film portrayals. Today, I'm going to break down 4 scientifically supported positions that significantly increase a woman's likelihood of orgasm, and not in a gimmicky way, but through anatomy, vascular response, pelvic alignment, and psychological safety. Before we begin, do one quick thing for me. Subscribe and comment your country below. I love seeing where you're watching from. Your engagement helps this channel reach men who deserve clarity instead of confusion. The real reason most women struggle to orgasm. More than 70% of women do not orgasm from penetration alone. That's not dysfunction, that's biology. The vagina has fewer nerve endings deeper inside. The clitoris contains over 8,000 sensory nerve fibers, more than any other sexual organ. Clitoral blood flow, not thrusting force, is the strongest predictor of orgasm likelihood. This means faster doesn't better. Harder doesn't more pleasurable. Deeper doesn't climax inducing. What works is pelvic angling, rhythmic friction, gliding contact with the clitoral shaft and internal legs, crua, continuous, not sporadic. When men understand that orgasm is a circulatory event, not a performance evaluation, everything changes. Pressure drops, presence increases, and intimacy strengthens. Position 1, woman on top, face to face. Biology. In this position, she controls depth, angle, pelvic rotation. This autonomy allows her to align the base of the penis against the clitoris and pubic mound with precision. Ultrasound response studies show increased clitoral perfusion in this posture because she is neither overstretched nor overpenetrated. Emotion. Women report less pressure to react correctly, more control, increased confidence. When she feels safe and in command, arousal isn't rushed, it expands. Technique tip. Encourage rocking forward back, grinding, not bouncing, slow pelvic circles. This is friction-based stimulation, not speed-based thrusting. Think motion, not impact. Position 2, missionary with pelvic tilt, pillow under hips. Biology. A simple pillow elevates her sacrum and creates anterior tilt. This shifts penetration upward toward the clitoral legs and interior vaginal wall rather than straight back. Result. Clitoral shaft plus internal bulbs receive pressure. Orgasm probability increases dramatically. Emotion. Missionary holds power because eye contact, breathing rhythm, and emotional attunement are maximized. A woman climaxing is not just reacting to sensation, she is responding to presence. Technique tip. Try one medium pillow, not a thick one. Slow, controlled thrusts, occasional pauses to let the pressure build. You're not rushing to climax, you're cultivating blood flow. Position 3, cat, coital alignment technique. A clinically studied method for women who struggle to orgasm through penetration. Biology. This is not missionary, but better. It is pelvic precision. Instead of thrusting, you slide forward, align pubic bone to clitoris, maintain continuous contact. This creates a gliding pressure against the clitoris throughout the entire motion, not randomly mid-thrust. Women who have never achieved orgasm from intercourse often do with CAT because it prioritizes static friction over repetitive depth. Emotion. She feels held, not pounded, connected, not rushed, seen, not examined. CAT is the physical embodiment of, I'm here with you, not performing at you. Technique tip. Think of sliding, pressing, and lightly grinding rather than entering withdrawing. Communicate. Tell me when this pressure feels right. Her feedback fine-tunes alignment more than any external instruction ever could. Position 4, seated face-to-face. Biology. This position brings pelvises close enough to allow predictable and sustained clitoral contact without pressure excess or overstretch. Not as intense as positions 1 or 3, but uniquely powerful for bonding, synchronized breathing, extended arousal buildup, emotion. Eye contact and chest-to-chest proximity increase oxytocin release, heightening emotional intimacy. Technique tip: enhance by placing a small pillow or folded towel under her pelvis, slow rocking instead of thrusting, gentle clitoral stimulation with fingers if mutually comfortable. This is a position of connection, not urgency. Universal pleasure techniques apply to all 4. 1. Pelvic angling. Positioning determines stimulation. Angles are more important than speed. 2. Rocking, thrusting. Static friction against the clitoris is the orgasm trigger, not penetration depth. 3. Shallowing. The most nerve-dense area is the first 1 to 2 inches inside the vaginal canal. Staying shallow can enhance her climax dramatically. 4. Combination stimulation. Penetration plus external clitoral stimulation equals highest documented orgasm success rate. 5. Communication in real time. Her breathing, hip movement, and face tell you more than words ever could. Ask: more pressure or less? Stay here. Is this angle working? Adjustment is not failure. It is anatomical precision. What about your performance? Confidence, reliability, and stamina depend heavily on blood vessel elasticity, nitric oxide availability, hormonal balance, and anxiety regulation. Natural circulatory support. L-citrulline, found in watermelon, converts to nitric oxide. Moderate resistance exercise increases vascular tone. Quality sleep, testosterone preservation. This is not about performing. This is about optimizing your health so intimacy becomes comfortable, not stressful. The real takeaway: female orgasm is not unlocked by force, speed, or complexity. It is achieved by understanding nerve pathways, optimizing pelvic architecture, creating emotional safety, maintaining clitoral contact, listening without ego. Pleasure isn't just climax. It is mutual presence, attunement, rhythm, and trust. Action step for this week: choose 1 position, 1 enhancement technique, rocking, angling, clitoral pairing. Then, talk to her before, move slowly, ask for adjustments, observe her breathing, hips, and expressions. This is exploration, not evaluation. If this helped you understand intimacy with real science instead of myth, subscribe for more medically accurate, respectful guidance from a board-trained urologist. You deserve clarity, confidence, and connection at every age and every relationship.